Every second matters when the heart suddenly loses its blood supply. Your heart muscle needs a constant flow of oxygen-rich blood to stay alive. That blood is delivered through the coronary arteries wrapped around the heart. When these arteries are open, oxygen reaches the heart muscle without trouble. A healthy artery has a smooth inner lining and plenty of room for blood flow. With enough oxygen, heart cells can contract normally and keep pumping blood. But over time, fatty material can begin collecting inside the artery wall. This buildup slowly narrows the passage where blood needs to travel. As plaque grows, less oxygen-rich blood can reach the heart muscle. This process is called atherosclerosis, and it can progress silently for years. High blood pressure puts extra stress on the delicate lining of the artery. High cholesterol makes it easier for plaque to build inside that damaged area. What idea do you want to bring to life? Smoking injures blood vessels and accelerates the formation of dangerous plaque. Obesity, poor diet, and inactivity can increase the risk even further. Diabetes and chronic inflammation also make artery damage more likely. Age and family history can raise risk even when symptoms are not obvious. As plaque becomes larger, its outer surface may grow thin and unstable. That unstable plaque can suddenly become the trigger for a heart attack. If the plaque tears, the body treats it like an emergency injury. Platelets rush in to seal the tear and begin forming a clot. What starts as a repair response can quickly become a life-threatening blockage. As the clot grows, blood flow to the heart muscle drops sharply. Sometimes only a small amount of blood can still get through. If the artery closes completely, the downstream heart tissue is starved of oxygen. What idea do you want to bring to life? Within minutes, the affected muscle begins to suffer serious injury. Without oxygen, heart cells cannot make the energy they need to survive. As more cells die, the pumping strength of the heart begins to fail. The heart may keep beating, but its rhythm can become dangerously abnormal. Abnormal electrical activity can trigger a deadly rhythm disturbance. If a large region is damaged, the heart can stop pumping effectively altogether. Something feels wrong. I need help. Now. Many people first feel mild pressure, tightness, or discomfort in the chest. That discomfort may slowly intensify instead of appearing all at once. Pain can spread into one arm or both arms. It can also travel into the jaw, neck, or shoulder. Some people feel the pain higher in the abdomen instead of the chest. What idea do you want to bring to life? Shortness of breath may appear with the pain or even before it. Unexplained sweating is another warning sign you should take seriously. Nausea, dizziness, or a sense that something is very wrong may also occur. In some people, especially women, the symptoms can be more subtle. Because the signs are not always dramatic, many people hesitate to act. They may assume it is stress, indigestion, or muscle pain. What idea do you want to bring to life? The classic movie version is not how many heart attacks actually begin. What idea do you want to bring to life? But while a person waits, heart muscle continues to die. The longer the blockage lasts, the greater the permanent damage. Irreversible injury can begin within about 30 minutes of complete blockage. This is why doctors often say that time is muscle. I think I'm having a heart attack. Please, I need help. Rapid transport allows treatment to begin as soon as possible. The patient is losing oxygen. Check the cardiac rhythm and get me his file. Prep 5 milligrams of atropine immediately. They may use an electrocardiogram to look for signs of heart muscle injury. Blood tests can also reveal whether heart cells have been damaged. Once the blockage is identified, restoring blood flow becomes the priority. A thin catheter can be guided through the blood vessels to the blocked artery. Imaging shows exactly where the artery is narrowed or completely blocked. A tiny balloon may be advanced to the blockage to reopen the passage. What idea do you want to bring to life? When the balloon inflates, it pushes the obstruction back against the artery wall. A stent is often placed to help keep the artery open. Once the catheter is withdrawn, the artery remains open, allowing blood to flow freely. Once blood flow returns, the heart muscle has a chance to recover. Recognizing the warning signs early can make the difference between damage and survival.